This child is 14 months and she's pregnant. So her ability to breastfeed this child has decreased to the point where the child now has edema and is about to die. That's why she took the baby to the hospital, because the child was about to die. Look at the blisters on those little legs. Look how listless this child is. That's what happens if the births are too close. It's not the new baby who dies. It's the one immediately preceding that dies. So we have to be really careful that this mother is, and what we use the term protected from pregnancy, as opposed to avoid pregnancy is kind of negative. We talk about a mother needs to be protected from pregnancy, because pregnancy is the leading cause of maternal mortality. Now we say protect from measles, so we need to say protect from pregnancy. Okay, here we go. This now, interesting. This is pregnancy is dangerous for mothers as well as for their children. This is the risk of morbidity and mortality by the age of the mother. And look how, by the time a woman is 20 to 24, her relative risk drops to basically 1. See, the baseline is here. Here's 1. If she is less than 15 years old, she is, let's just look at maternal death. It's a bit more interesting. Less than 15 years old, she's 4 times more likely to die from from childbirth than if she was even 16 or 17. But we say wait till you're at least 18 before becoming pregnant. Just because of the other complications that can occur. The golden age for a woman to have a child is 20 to 24. I'll show you some more about that. And also, it's interesting, this shows you that a woman, a girl less than 15 years old, is basically almost 5 times more likely to die than a woman who's 20 to 24 from maternal mortality causes. Now, here you go. With a birth to pregnancy interval of 24 months or less, mothers themselves are more likely to die. So that's MDG5. Newborns whose mothers die in childbirth are 3 to 10 times more likely to die before age 1 than those whose mothers live. So that's infant mortality. When a mother becomes pregnant with a second child while she is still breastfeeding, her ability to breastfeed is reduced, and the older child, as we saw in the picture, is more likely to die than the newborn. But with a birth to pregnancy interval of 27 months or more, the older child is grown enough to survive with more limited maternal care. If there was an interval of 27 months or more, can we do some math for a minute? A birth to pregnancy interval compared to a birth to birth interval. It's a little bit confusing. A birth to birth interval is a birth to pregnancy interval plus 9 months. Okay? So a birth to birth is, the best is 36 months. A birth to pregnancy is 27 months, and then you add 9 and you get 36. Just see how that goes? Okay. If there was a birth to birth or a birth to pregnancy interval of 27 months or more, child deaths would drop from 9.1 to 8 million annually, and maternal deaths would drop from 536 to 631 annually. I think, okay, let's go on here. Now we're going to look at maternal, perinatal, and pregnancy outcomes. I think we saw a better one of that. So we're going to go on now to the impact of healthy timing and spacing for adolescents. For teenage mortality, pregnancy and childbirth are the leading causes of death for girls globally. It's not HIV/AIDS. And yet, where does all the money go? Pregnancy is the leading cause of death for girls under age 20. Girls aged 15 to 19 are twice as likely to die in pregnancy and childbirth as those aged 20 to 24, and girls less than 15 are 5 times more likely to die. Infants of teenage girls are almost twice as likely to die as those born to mothers aged 20 to 29. So how do you reduce infant mortality? Yeah, prenatal clinics are really wonderful. I totally agree. But the first thing you should get when you go to a prenatal clinic is advice on how to space the baby once you get that baby. Now we're going to look at impact on abortions. We mentioned it briefly, but 13% of global maternal mortality is caused by unsafe abortions. And in the year 2000, 90% of abortions could have been averted if women had access to contraception. So in the United States, when they say, oh, we can't do family planning because family planning causes abortion, the answer is no, it prevents abortion. Family planning prevents abortion. And you'll see always, as abortion declines as family planning use increases. It's a perfect inverse ratio. In developing countries, 2.5 million teenagers annually end pregnancy without medical assistance, and that's why they die. Because girls especially they don't feel comfortable going to a hospital. They'd rather go to a backstreet person who is going to end their pregnancy. Now we're going to look at healthy timing and spacing of pregnancy on mother-to-child transmission of HIV/AIDS. Family planning added to PMTCT can save the lives of thousands of women and reduce the number of orphans. A study of unmet need in family planning in Uganda found that 700 women start ART, but they're not offered family planning. You know, that's really outrageous. We're giving them ART, but we're not helping them protect themselves. When 700 women did start ART, 85 pregnancies occurred. 97% of these women did not want pregnancy. 99 did not want pregnancy at this time, and 79 said their partners did not want pregnancy. And yet, because we have a stovepipe approach, we offered them ART without offering them family planning. I would say it's immoral to do that. The woman's right there, she needs help. And not to offer family planning is very bad. Women do want to space their pregnancies. In 27 developing countries, 90% of women don't want a child within 2 years. Okay, 3 minutes. But only 40% are using a method. Okay, more than half of all the births in developing countries are less than 3 years apart. So there's a huge need for spacing, helping those mothers space. Here, I just said that told you that. Okay, these are the messages. These are the messages that we use at World Vision, which I'd like you to take away with you. After a live birth, wait at least 24 months, but no more than 53 months before trying to become pregnant again. Do you know what happens if you wait longer than 5 years? We don't know actually what happens, but maternal mortality starts to go up again. And we think it's because a mother's body sort of goes back to the state it was in before her first pregnancy. So really 3 to 5 years is the golden interval. After a miscarriage, wait at least 6 months before trying to become pregnant again. How many of you know people who had a miscarriage and they go home and they try and get pregnant the next day? Yeah, please don't. Yeah, please wait 6 months. And then until your body gets back to its normal state, and then you'll have a much better chance. Delay your first pregnancy until you're at least 18-year-old. Then limit pregnancies to your healthiest years, 18 to 35, and protect yourself from pregnancy after age 35. What happens after age 35 for mothers? Maybe I can show you. No. Mortality goes up, just like that. Yeah. What has the biggest impact on mothers dying after age 35? Is it the number of children or the age of the mother? It's the age of the mother. It has a slightly higher impact on maternal mortality than parity, the number of children that she's had. So this is our bottom line. You're going to have healthy newborns, infants, children, women, happy, stable families and communities, and they all lived happily ever after. And that's the end.